Every day, guys, when I talk to patients, especially new patients, I always look at the medications they're on and I ask them, do they go and look up the medication for the side effects? And the answer is usually no. So when the person handing you some drugs, do you not ever go look and see what the drugs are made of, the chemical structure, but as anything, do you go look at these side effects? And sometimes even your MD giving you these drugs is not even giving you all the information. And I'll make this very clear. There's things called statin drugs, right? The statin drugs are the famous cholesterol drugs that's been around to say you have high cholesterol, so automatically take these statin drugs. And why do you take these? Because you don't want to get a stroke or heart attack. Well, if you look up the drugs.com and it says instead of going as a patient, click on practitioner. That's the key thing, drugs.com, and click like you're a practitioner. And that's how you get the juicy information. And then you look in there, and what's the side effects of these statin drugs? Heart attack and stroke. How about that? So you're taking this to avoid that, but yes, the side effects are exactly that. So besides that, what else is under there that they don't tell you as a patient? Cancer. Cancer is also a condition you can come about by taking statin drugs. Now, if your medical doctor is giving you statin drugs, you should be asking questions just like these. What are the side effects? What is this going to do for me? So if your doctor does not tell you one other very important thing, that if you take this statin drug, it will suck the CoQ10 out of your heart. So basically, CoQ10 is the nutrient you need for your heart to function properly. So without CoQ10 in your body, which is statin drugs will deplete from your body, you will have a heart condition. So if your doctor does not inform you to take CoQ10, if you decide to take a statin drug, I would do one thing, change doctors. Make sure you go to a doctor who does his research and tells you the side effects, which are very important for you to know. So statin drugs, guys, do you need them? Dr. Jaffe, the world famous PhD, probably got like 10 PhDs that I studied with years ago with Dr. Jaffe. He said cholesterol drugs, this is him. He said cholesterol drugs are a scam. He goes, the body is healthier with high cholesterol. Low cholesterol is where things get unhealthy for your brain, your sex life, your body, your energy. And if you don't believe him, just go take a statin drug for a couple of weeks and then walk up some stairs. Notice that you have no energy in your legs. You have like these giant tree trunks that you're carrying around legs trying to walk because of the number of the statin drugs doing on you. Dr. Jaffe said one thing you should do. He goes, when you look at blood work, forget cholesterol. It's a scam, according to him. He says, look at the triglycerides. Triglycerides tell you how the thickness of your blood is. If your blood is too thick, the heart is pumping really hard, thick blood like motor oil through the body. So you must thin your blood. How do you do that, Dr. Jaffe? He said, take fish oils. Every meal you eat, take 1,000 milligrams of fish oils, and that will sufficiently thin your blood. They also talk about niacin. You know, good old B3 gives you the niacin flush. Start very slow because you'll get that flush. Those who take it know what I'm talking about. Niacin B3 helps with the excess cholesterol. And by the way, cholesterol is needed in your brain. It is needed in your liver. You must have cholesterol to function as a human being. So today, guys, take your statin drugs and just, I'm not your medical doctor, but in my opinion, and flush them down the toilet. Have a great day, guys.